Inside your brain right now, there are structures whose entire job is to approve your movements and decline them. One says yes, two say no. And they're locked in a permanent negotiation over every move you make. Break that negotiation and you get either a patient who cannot move at all or one who cannot stop moving. I'm a neurologist. I teach medical students and residents every single day. So this is part of a series on neuroanatomy where we draw a map of the nervous system, and with each pass we learn the map and go deeper and deeper till you're a master. But everything you need for today's episode is right here. Okay, so now let's make sense of that negotiation that's constantly happening in your brain. Now, we've spent the last few episodes deep in the center of the brain. We did the internal capsule, pure motor. We did the thalamus, pure sensory, the great relay station of the brain. And now we move to the structure sitting right alongside them, a cluster of nuclei, cell bodies that do something completely different. They do not carry movement out to your muscles. They do not carry sensation up to your brain. They shape movement, and they are the basal ganglia. So as always, please excuse my absolutely horrendous drawings. So we're going to draw once again. So this is an axial view. We've cut the head from this way and we're looking down into the head. And I'm going to draw a line down the middle, and we're going to call this the left, and we're going to call this the right. So let's start off by naming the players, because this is the part everyone trips over. Okay, so the first name off the bat is the caudate nucleus. Now, the caudate means tail. It's a long, curved, comma-shaped structure. So if we were to draw the caudate, it would be at the very front, and we'd do it like that. So this is our caudate. Now, sitting next to it is the putamen. It's a rounded structure just lateral towards the outside. Lateral aspect just outside. This is the putamen. Now, the caudate and the putamen together have a single name, and we call them the striatum. So when you hear the word striatum, think caudate plus putamen. So we're just going to put a little formula up over here. So we'll say caudate plus putamen equals striatum. So this is the striatum. I'm just going to put a little arrow there. This plus this equals striatum. Just another name. Now, tucked inside the putamen, just inside of it, is the globus pallidus, the pale globe. So let's draw the globus pallidus, which kind of sits here. Label that. Globus pallidus. Now the putamen and the globus pallidus together, and because they sit side by side, they kind of look like a lens, and so that's called the lentiform nucleus. So the lens-like nucleus. Now nucleus just means cell body. So every time we're talking about this, these are cell bodies that are living in this location with axons going out from them. So here I'm going to say on the side, I'm going to say putamen plus globus pallidus equals lentiform nucleus. Beautiful. And so this kind of structure here, kind of do this. This is called the lentiform nucleus. So we've got the caudate, we've got the putamen, we've got the globus pallidus. Really, that's it, 3 structures. We've just got different names when we add them together. Now, I'm going to introduce you to 2 more. Now, down in the midbrain, a small structure called the substantia nigra, the black substance. And so remember, the midbrain kind of comes through here. So I'm just going to do a dotted line of where the midbrain sits. And we're going to put it in black here. And we're going to call that the substantia nigra, the black substance. And we're going to call this substantia nigra. Now, if you remember back to the last episode, where did the thalamus sit? The thalamus actually sits in the back here. So if we were to draw the thalamus would sit in the back here, the posterior aspect. Now, not perfectly drawn in this specific diagram, but just for your kind of thinking and how we process this, just going to label this thalamus. Right at the front here, just below the thalamus, exactly where the name says, is the subthalamic nucleus. So I'm just going to put this just here in dark. And again, it doesn't actually look like that when you look at an axial of the brain, but I'm just trying to fit it in. That is our subthalamic nuclei. Here is the negotiation I mentioned earlier. Now, the substantia nigra approves movement. The striatum and the subthalamic nucleus decline it. They work together in a balance and they keep the whole system in perfect harmony. Enough movement gets through, but not so much that things go wrong. Okay, so let's just explain this like an analogy. Think of a young man, okay, or a young woman, and she's just inherited an enormous fortune, a trust fund kid. Now, this kid, he has unlimited money, every impulse you can imagine, but he has absolutely no judgment like a typical trust fund kid. Now, left completely to himself, one of the two possible choices might happen. He may do absolutely nothing, sleep in, never get out of bed, never act, or does something reckless, buys a Lamborghini on a whim and wraps it around a tree by the afternoon, buys a Patek Philippe just because he can. Now, that young man is your primary motor cortex. All the power, no control whatsoever. So who keeps him in check? That's his trustees. The law firm that manages the fortune and decides how much money actually gets spent, how much gets released, and when. So the kid wants something, he puts in his request, the firm regulates it, enough gets released to move freely, but not so much that he does something absolutely reckless and catastrophic. The firm just controls and regulates the flow, and that's what the basal ganglia is, that law firm, that trustee, whereas the primary motor cortex is that utterly useless trust fund kid that doesn't know what to do. So if we were to draw this somewhere here, let's use pink, your primary motor cortex, if you remember, is going to be in the frontal lobe, and it's going to sit right about here. So let's color that in. So here, let's just say, is your primary motor cortex. Now the substantia nigra, this part here, that is the partner in the firm who holds the rubber stamp, the one who can approve things. It does this with dopamine. Dopamine is the approval signal. Now the striatum and the subthalamic nuclei are the partners who push back. They're the ones who say, not yet, not that, slow down. They are the decline side of the negotiation. So working together, the system hums. But in diseases, one side of that balance collapses and things go wrong. Now, a law firm can fail in two opposite directions. It can become far too restrictive, freeze accounts and release almost nothing, or it can lose all the oversight and let money leak out uncontrolled. When the firm freezes the accounts, the kid wants to move, but nothing gets through, nothing gets released, too little movement. Kids become slow, stiff, lies in bed all day, does absolutely nothing, frozen, hypokinetic, too little movement. Now, when the firm loses control of the money and it doesn't really regulate it, then too much gets out, hyperkinetic movement. Now, every basal ganglia disorder you'll meet sits somewhere on this line, and any movement disorder you see in clinic sits somewhere in this line. So let's start with too little movement, hypokinesis. So if the dopamine, the approval signal, is gone, you lose dopamine, you lose that rubber stamp, then the firm can only ever say no. There's no approval. It's always no, no, no. So every request this trust fund kid puts in is refused. He wants to move, almost nothing comes out. That's Parkinson's disease. The substantia nigra degenerates and dopamine falls. The patient becomes slow, bradykinetic, stiff, rigid, with a tremor at rest. Slow, stiff, hard to get going. And that's why we treat Parkinson's patients with levodopa. We're topping up the dopamine. Now let's look at the other hand. The firm loses control, too much movement. And here we get two structures. We get the first one, which is the striatum. When you remember, that's the caudate plus the putamen. And that part of the firm doing day-to-day oversight. When the caudate degenerates, oversight collapses and money leaks out constantly. So the partner is saying approve, approve, and no one's pushing back on that. And so you get these uncontrolled movements at the body, and we call that chorea. That comes from the Greek term for dance. Flowing, irregular, restless movements that drift from one body part to the next. Like the patient is fidgeting and they can't hold still. And the prototypic disease is Huntington's, where Huntington causes caudate degeneration. The caudate progressively wastes away and the patient develops chorea. So caudate lost, oversight lost, we get chorea, and we see that in Huntington's disease. If you're finding this useful, please subscribe now. I wasn't born with a trust fund, so please help me out. The second structure on this end is the subthalamic nucleus over here. Its whole job is to put the brakes on big movement, knock it out usually with a small stroke, and huge reckless withdrawal goes straight through. So this is supposed to be the final kind of checkpoint to say, nah, nothing's getting through. So you lose this, the kid goes by as a Lamborghini, and what you get is the most dramatic movement disorder of all. And that's hemiballismus, one side of your body, ballismus coming from the Greek for throwing, and it's violent, large amplitude flinging movements of the limb on one side of the body. The whole arm or leg thrown out. Unmistakable. Can't forget it when you see it. Now that's a tiny lesion in one small nucleus, and you get this enormous wild movement on the opposite side, and that's hemiballismus. Now let's go through a case. We've got a 68-year-old man, high blood pressure, diabetes, so lots of small vessel risk factors. Over the course of a day, he develops left arm and leg movement, and they're moving on their own. Not a tremor, not a twitch, large, violent, flinging movements. His limbs are being thrown out, his shoulders and his hips, and he can't stop moving at all. Everything else is normal. No weakness, no sensory loss, no language difficulties, just this wild movement. Let's reason this through. Is this central nervous system or peripheral nervous system? First question we always ask. Well, it's unlikely to be a peripheral nervous system problem. We are not using motor to localize it, but really this is a movement disorder, and we don't see movement disorders from the peripheral nervous system, so we say central. What's the height of the lesion? Well, I've said that there is no language issues, no aphasia, no cortical signs, so we're thinking lower than that. And really, I mean, we've just gone through an entire tutorial. We're dealing with movement, right? Too much movement. So we're going to localize this to the basal ganglia. Now, basal ganglia is to do with movement, too much or too little. There's no weakness there at all. There's no sensory loss. So we're not in the internal capsule of the thalamus. We're sitting in the basal ganglia. Too much or too little? Well, it's far too much. The firm has lost control. Which structure produces too much movement? Now that's either the striatum or subthalamic nuclei. And within that, which structure produces a huge reckless withdrawal with flinging of an entire limb? Subthalamic nucleus. The striatum, and specifically the caudate, would cause chorea. So the lesion is in the subthalamic nucleus. And which side? Well, the movements are on the left-hand side. And the basal ganglia, like the rest of the brain, controls the opposite side of the body. So the lesion is going to be in the right subthalamic nucleus. And in a man with vascular risk factors, and it's occurred quite acutely, this is going to be a small stroke right there. And this is a classic cause of hemiballismus. Now, before we finish, I want to leave you with something to work at. Put your answers in the comments below. Now, in Parkinson's, we are giving back the dopamine. The substantia nigra has lost that ability, and so we're giving the patient levodopa. But if you give too much, patients can develop extra involuntary writhing movements of their own. Now, using the analogy we've talked about today, what has happened? If dopamine is the approved signal, what does too much of it do to the firm? Tell me your reasoning, and tell me what kind of movement they're developing. Now, next week, we leave the deep gray structures, we leave that subcortical area, and we drop further down into the brainstem. This is where it gets dense, because in a space smaller than your thumb, every motor fiber, every sensory tract, and a dozen cranial nerves are all packed together. This is where neuroanatomy and lesion localization gets genuinely extraordinary. This is where neurologists truly get to shine, and this is why you wake up in the morning. And we will learn all of this using the famous rules of 4, and it will make complete and perfect sense. And by the end, you'll be localizing to 2 millimeters within the nervous system. Now, subscribe, turn on that bell so you can catch the Brainstem episode next week. And if you're new here, go right back to the first episode and start the series from the map, because everything builds from there. And with each episode, you'll feel your localization getting better and better. Please send this to someone who's still trying to memorize movement disorders instead of understanding them. And I will see you next week.